times already, but just a couple of reminders that the event is being recorded and also live streamed through YouTube. We have interpretation today, and you can choose your interpretation, your language in the bottom, in the little globe there. And we have French and Spanish interpretation today, as well as Arabic. So you think it's best that you choose your language from the beginning so that you can hear the content in the original language. I also we'll go over this later, but we're hoping that this is a very interactive session. So there are several different ways you can start interacting with this event and the content here. We encourage you to share your questions on the chat. You can raise your hand once Michi start the conversations and opening the space for questions and so on. So I'm gonna go ahead and introduce Mita Moragas. Michi, well, kindly calling Michi, Mita Michi, but Mita Moragas is a lawyer from Paraguay. She's a feminist activist and human rights advocate. She's a member of RESURJ and also a founding member of the Vecinas Feministas. Although she's not going through all the details of the report today, she's kindly have agreed to moderate. She's one of the author of this report, and she's also currently with Synergia. I will pass it on to Michi so she can introduce the panelists, and thank you so much for being here today.
Thank you, Marisa, and thank you all for being here. I know these are really busy days. Of course, we would have preferred to see you all in New York and hug each other, but this is how pandemic goes. This report that we are about to launch is the result of several conversations that we have having in the last few years regarding the limits of criminalization from a starting point to protect and reinforce sexual and reproductive rights. But after that, since the pandemic started, we saw with concern how criminal law and criminalization has been displayed in different countries in the context of the pandemic. So we started to think about that, and then we decided to analyze how this dynamics works in different regions. So we had we researched in different regions. We had conversations with experts in different regions, and also we launched a little survey about how all the criminalization are taking place in different countries in the context of the pandemic. So we have these three amazing panelists today to speak with us about some trendings that we found in our joint interregional analysis, and I'm going to present them. And after that, I have like little questions for each one. And after that, we hope to open the space for a more collective reflection about this. So our speakers are first, Lucia Berro Pizarrosa. She is a member of Vecinas Feministas. And as you know, Vecinas Feministas is a feminist network working around sexual and reproductive justice in Latin America. Lucia is also an associate of the O'Neill Institute for National and Global Health Law at the University of Georgetown and research fellow at the Interdisciplinary Center on Adolescent and Sexual and Reproductive Rights at the University of La República in Uruguay. She holds a PhD in international law from the University of Groningen and MJUR from the University of Oxford and an LLB from the Universidad de La República in Uruguay. Then we have Marie-Claire Price. Marie-Claire is a member of the RESURJ Secretariat. She is also a member of RESURJ since 2012. Marie-Claire leads on thought leadership, interlinkages, and the shortcoming of criminalization work with RESURJ. She was previously the executive coordinator of the Women Human Rights Defenders International Coalition, the Youth Coalition for Sexual and Reproductive Rights. And then we have, last but not least, we have our beloved Nana. Nana Abwetson is a research member. She's also a researcher on sexual and reproductive rights at the Egyptian Initiative for Personal Rights. So after introducing to you to our amazing speakers, I would start by having this conversation with Lucia first. And I have like 3 little questions for her. And the first question, Lucia, is what does use of criminal law mean in this context? Are we talking about existing laws or are we talking about new laws? So we go with you, Lucia. Thank you.
Can you hear me now?
Yes.
Perfect.
Yeah.
So thank you so much, everybody, for coming. And thanks so much, Michi. I know you as a moderator, and it's always a pleasure because you keep us running on a tight schedule. So about the question, so what we try to do with this report is to draw a map and take, have an overview of what are the measures that have been taken in the context of the pandemic, right? But we were not particularly interested so much on the public health measures, but rather on the criminal law kind of measures. So while we see that across regions and even inside the regions, there's a lot of disparities in terms of like, where are the public health measures that have been taken, let's say use of the mask, mandatory quarantine, and so on and so forth, we see that there's something that unifies them all, which is sadly the use of punitive measures during this pandemic, right? And this is twofold. And that's why when we say use of the criminal law, we refer to 2 different types of use. On one hand, the use of old provisions that were there in very outdated criminal codes, and the implementation or adoption of new criminal penalties regulation, right? Like, for example, when I say the use of the old, I refer of the case of Brazil, that in March 2020, the Ministry of Justice and the Ministry of Health, they both announced together that they were going to impose prison sentences for those who did not comply with the mandatory quarantines. And this was based on an article that is from the criminal code that dates from 1940, which has to do with the power of authorities to prevent the spread of contagious diseases. Right, so there's this use of very old laws that belong to a different time, and that had like yielded a serious set of criticisms, still to curb a pandemic, a global health challenge using these kind of tools, right? And it is very real in a sense that, for example, in Peru, using a similar article of the criminal code, during the first week of the quarantine, there were 16,000 arrests made for non-compliance of these rules, right? So it is very clear how, the very important effect that this had on the population. And then besides those, as I was saying, those set of provisions that have to do with the prevention of spreading of contagious diseases, that have also been used in HIV cases, for example, and have shown that the really harmful consequences of the use of criminal law in these cases. There was a very creative use of the existing criminal law. For example, in Venezuela, people were prosecuted, for example, for biological terrorism under the law against organized crime. All of these for breaching public health measures, right? And on the other hand, so these these are all old provisions, but then on the other hand, there are also new provisions in the sense that, for example, Panama created a new rule in which an offense for breaching the quarantine could cost a fine of around $50,000. And if you were a repeated offender, you could be charged out of $100,000. In up to April 2020, what is more or less where we did a little bit of a cut in the data collection. In Mexico, there were around 20 initiatives of modification, of reform of penal codes in order to incorporate the breach of quarantine as a criminal type. And then, for example, like the Nuevo León Congress passed a reform in June last year, adding an article to the code related to the willful endangerment of the population's health, right? And the same in Chile with around 5 years of prison for breaching the measure. So, like, let's say that the inflation of the criminal system is not a new issue in Latin America or around the world, but I think it's really important that we bring it to light, and that's what we wanted to do with the report, because I think it's important that we remind ourselves and our governments and hold our governments accountable in the sense that transmissible diseases are a matter of public health, should not be made a criminal problem, and that the use of these punitive measures like further exacerbates the inequalities, right? We're all under a lot of pressure in terms of like economic distress, political, and so on and so forth, in order to, to have our governments use one of the most violent tools that they have at their disposal, which is criminal law. So that's what we meant with the use of criminal law.
Thanks, Lou. And besides the measure adopted specifically to curb the pandemic, it seems like many governments have passed a series of other initiatives taking advantage of the situation created by the virus. Could you comment on that and share some examples of these findings?
Yeah, absolutely. I think in that sense, let me close here. In that sense, what we wanted to point out with this particular is the opportunism of our governments, right? I feel like the pandemic has clearly has shrinked civil society, clearly has closed a lot of spaces of political participation. I mean, we are witnessing it along with CSW, the very limited engagement that we can have and very limited advocacy opportunities that we can have at this point because of the measures that have been in place. So some of the governments have taken this as an opportunity to pass a series of other measures that had nothing to do with the pandemic, but that regulate very diverse things. For example, in Bolivia, one of our colleagues, Andrea Terceros, she was telling us and sharing with us the situation that was going on, in which the de facto government really had found in the health emergency created by the pandemic as the perfect excuse to politically prosecute everybody that opposed, right? So for example, the government reported that those that were they were supposedly breaching quarantine and trying to destabilize the government and so on and so forth. But basically, it's people that were out protesting, asking for better social assistance, for better measures to curb the pandemic, but they were criminally prosecuted. And I can speak also about like my own country, Uruguay, in which the pandemic proved to be like such a fertile ground for a whole set of new regulation. For example, right at the beginning of the pandemic, Uruguay adopted what is called a law of urgent consideration, which was an abbreviated process in which a lot of people could not participate. It didn't have the democratic debate that it should have. And it was a law that had more than 400 provisions. And some of them had to do with budgetary concerns, and some of them had to do with completely unrelated things like police power, for example. One of those articles regulates police powers and establishes a presumption of legitimacy on every police action, which is absolutely, it really gives a lot of, it provides way too much lenience in terms of police behavior. And we have seen that even during quarantine, a series of abuses. So the population has been mobilizing, trying to gather signatures in order to take this law for a referendum in which we can actually, this law can be derogated, but we can actually have a serious democratic conversations that these type of issues like police powers merit and should not be diluted in a moment in which we have no possibility of like properly engaging in these debates.
Thank you, Lou. And this is my last question for now for you. And furthermore, the report speaks of the use of law and policy supposedly COVID-19 related as tool as social control. Can you explain a bit further this phenomenon and how have you observed this in the LAC region and beyond?
Yeah. This is something also very, very curious that we found is the use of these measures that are intended to stop the spread of the disease, but actually in a way in which they're actually furthering the inequalities, right? And really taking a social problem and exerting social control on a particular direction that the government or the state wants to go. Like let's say, for example, this becomes a bit abstract, but I want to share a couple of examples that are also there in the reports. Like in many countries, there was an adoption of national quarantines, but then people could go outside divided by gender. It's like, what is the public health rationale behind the division of the quarantine or the possibility to go outside divided by gender? It doesn't, I mean, there's no evidence or international human rights standards that can be used to justify that. And on the contrary, this led to a series of like super heinous violations towards people, for example, like trans people that were forced to go out on the time allocated to that of their identity card, for example, right? And there's a series of violations of like, there's documentations on cases in which the trans population was harassed or was like kind of like subjected to violence because of they having like using the time to go outside according to their gender, right? So I think this is also something that we need to be very, very cognizant on the way under the disguise of public health measures. We're not reinforcing, in this case, gender binary and gender division, which is it makes no sense from any other perspective, public health or human rights. And the same, for example, with the distribution, sale, and production of alcoholic beverages. Like, why do we have dry laws in, for example, Mexico, Guatemala, and Panama, right? Like, so what these measures actually do is that they promote the proliferation of illicit commerce, increase the contagions of COVID-19 because the establishments that the point of sales are not complying with any other of the preventative measures dictated by the governments. And also maintaining this dry law, it just diverts security forces from ensuring that there are no sale of alcohol to actually lessening the capacity to deal with the health crisis, right? So there's all of this conversation that needs to be had, and we need to try and like provoke a kind of like a dialogue, at the least, in terms of like what is the actual rationale behind these measures other than basically controlling social control, right? And the same with, for example, poverty. It was very, very clear that the monitoring and enforcement of public health measures was done on a complete class-based, right? Class difference. Like in Costa Rica, for example, in poor neighborhoods, like very clearly the police, very rapidly, the police was dispersing people, while in the middle-class neighborhoods, there were weddings being celebrated and they were only being policed after there was like a massive backlash on social media. So it's the use of these measures, supposedly public health measures that have no rationale behind them, to really police people in their gender, in their class, and yeah, so on and so forth. Yeah.
Thank you, Lou. Thanks. Now we're going to shift to Europe, and we're going to have this conversation with MC, as we call Mary Claire. And MC, how have existing systems of power and inequalities in the region been exacerbated by the trend of a criminalized and punitive approach to the pandemic?
Thanks, Michi. Can you hear me okay?
Yes. Yes.
Thanks. Yeah, I mean, where to start really on this one? I share a lot of reflections that Lou also shared, and I think that part of this report is a cross-regional analysis where we're seeing what the actual trends that are similar in different regions are, and a lot of what Lucia has been sharing from LAC are very similar to what we're seeing in Europe. So from the responses we received for the report, from the survey, and from what we know and what we're seeing, Europe, like other regions, has seen a disproportionate use of existing or new criminalization measures, laws and regulations to respond to the pandemic. And very few countries in the region have focused on or prioritized social protection measures in addressing the pandemic and its impacts. And because these responses are so focused on criminalizing measures, on penalties, on control, it's had and continues to have a significant impact on the most marginalized communities in the region, and it significantly outweighs any of the social measures that have been introduced to respond to the pandemic, whether that's increases in living or national wage, furlough schemes, eviction bans that we see in different countries across Europe. And the measures that are being prioritised by governments in the region were those related to, or the criminalised measures related to movement, to social contact, to public gatherings, sanitary measures like mask wearing, etc. And this approach, or the approach to this, means that the breach of these measures were, the response was majority punitive, ranging from dispersal of groups in public spaces to fines for individuals, fines for businesses, court summons, prosecution, detention, arrest. We've seen that across the whole region. And although there was continuous changes, adaptation, reversal of laws as the pandemic continued earlier last year, the reason for this, some laws only lasted a couple of days or a couple of weeks as they were challenged through constitutional law, by human rights lawyers, or just by public pressure. And as Lou was sharing, in Europe as well, political opportunism has really been at the centre of many governments' responses. So this shrinking and closing of civil society space, of stopping protests, the right to protest, closing borders, bolstering anti-migrant, xenophobic rhetoric, increasing deportations, progressing the privatisation of health services, or restricting information and media, or even like moving forward regressive trade, aid, domestic or foreign policy. Like, these are all the things that we're seeing in terms of political opportunism in the region. And the pandemic also exposed the ways in which existing inequalities, poverty and discrimination could have actually quite easily been addressed previously, as we know, in the ways in which we've been calling for many years as activists. In some countries, policies and measures were introduced as part of a response to the pandemic literally overnight, measures that civil society have been calling for years. Things like telemedicine, including for abortion services, housing for rough sleepers or street homeless, increasing living wages, releasing prisoners or detainees, or like, for example, women in prison who are detained for minor offences, increasing exits of prisoners. Like, all of these are, they always have had the potential, these measures, to significantly reduce inequalities. And they weren't constrained by budget or practicality, as we've been told, but instead by political will. And we've been seeing unprecedented and significant expansion of police and surveillance powers, as we all have in our regions, and the power that's held by surveillance authorities, immigration authorities, and restricting freedoms in ways that were totally disproportionate and way beyond what is necessary to respond to a public health crisis, as Lou shared from Latin America and Caribbean region. It's been used as a political opportunity for increased monitoring, for closing of civil society space, restricting the right to peaceful assembly. And we're seeing more of that. We're seeing that being built on. So, for example, in the UK, we've, in the region, we're seeing anti-police, anti-lockdown protests from Austria to Spain to France to Belgium to the UK, the Netherlands, who are protesting against the lockdowns and the police response to that, and also against systemic racism and gender-based violence. And a recent demonstration in the UK, I heard someone speak about the policing bill that they have introduced here, which is again building on the already very restrictive measures that have been brought in related to coronavirus, and brings in draconian measures that don't support survivors of gender-based violence, but instead further victimize them. And they said that we cannot police our way out of this crisis when policing is actually the crisis. And I thought that was a very significant and powerful thing to say in terms of the context which we're facing in the region.
Thank you, MC. And how have marginalized communities in Europe been affected by this approach?
I think the propensity of governments in the region towards this criminalized approach has significantly impacted and continues to the lives of the already very marginalized groups. Like the prisoners that I mentioned before being deprived of activities and contact with family, sex workers having to risk both criminalization and COVID because of the lack of recognition of them and legal and social protection, migrants separated long-term from family and their communities, human rights defenders and civil society, the impacts on them being able to hold space, to hold governments accountable for their actions. And yeah, I mean, you know, we're seeing from the survey, we're seeing so many responses in terms of most marginalized groups and the impacts on them. Homeless, those with undocumented status, drug users, LGBTQI, the impacts are major for these groups and will be for years to come. And those, for example, working in informal economies or with precarious working, seasonal workers, migrant workers, domestic workers, and the criminalized approach and restrictions that we've been seeing has just exacerbated the ways in which these groups are already experiencing, for example, limited access to healthcare. Those with undocumented status, for example, already have very little or no access to primary healthcare, sexual health services. Oh, sorry, thank you. Someone's telling me to slow down. And then, for example, I mean, Lou was mentioning trans persons, and some health services are already inaccessible for LGBTQI people who are already experiencing stigma, discrimination, gatekeeping in health services. They're being even more restricted by travel restrictions or lockdowns, when usually they could, or in some contexts, be able to go further afield to access services. And for example, with trans people whose transition-related care has been postponed or deemed non-urgent in the context of COVID. Sex workers, I've mentioned, have faced significant impacts, particularly in the countries where there is no legal framework that exists to support them, and there's a lack of recognition of their legal status. They've faced risking opening services to clients and risking COVID, especially in contexts where they cannot access social support and protection. It puts them at risk of both criminalized sex work and criminalized social contact. So it's like double criminalization. So I'm just going to ask for a time check.
You're okay, you have.
Okay, thank you. Many migrants have been able to, for example, have been unable to access information about COVID in the region because it hasn't been translated into the languages required to reflect like access for diverse migrant communities. And you know, migrants, asylum seekers, refugees have shouldered a significant impact from the restrictions of movement, closure of borders, non-extension of visas, and restrictions imposed on or restrictions that are imposed as well on movement within refugee camps in Europe. So yeah, the trend is a concerning one when it comes to the impact on marginalized communities, and when the health and lives of the most marginalized are at risk, and that they face double criminalization, double stigmatization, being further pushed and ostracized within a context that sees a response needs to focus so heavily on punishment and not actually addressing inequalities and supporting communities. We've got a big problem on our hands. So yeah, I hope that answers the question.
Thank you, MC. Thank you also for your use of the time. Before going to Nana, I want to remind you that you all can post your questions or your comments in the chat box, and later we will start our conversation with all the panelists about different trendings and what you have and all we are seeing in this conversation. So we're going to Nana, and I want to start by asking kind of the same question that I asked to Lucia about the social control. So the reports speak of the use of law and policy supposedly COVID-19 related as tools of social control. Can you explain a bit further of this phenomenon and how have you observed this in Africa and Swana region and beyond, Nana? Thank you and welcome. Nana, are you there? I think we lost Nana. Yeah, we lost Nana. So in the meantime, hoping that Nana is coming soon, I have one comment in the chat box, which is a comment by Pamela from Argentina that says, let me find it. She says that, I'm sorry. In her country, in Argentina, in a province called Formosa, the government installed isolation center against people's rights. They separate women from their newborn babies and force them to have cesarean sections. So that's another thing that we saw in Latin America. So waiting for Nana, I want to propose a little bit more to hear a little bit more about Lou and from Marie Claire about what stood out of what we see in our joint and cross-regional analysis about especially about similarities across different regions and countries. I don't know if Lou, you want to kick off that, and after that we can hear to Marie Claire if.
Yeah, definitely. Thank you, Michi, and thanks, Marie Claire, for sharing also your observations and about what is happening in Europe. So I wanted to pick up on Pamela's comment in the chat, because I think this is absolutely important. Like, while it is not directly related to criminalization, I think it's really important to take a look at what does the measures taken by the pandemic meant for reproductive health, right? And I think Marie Claire was raising some of these issues, but for example, people are having to give birth by themselves, alone, no support, without seeing anybody else. In many cases, separated from their partners, and so on and so forth. So it's for example, abortion services have not considered essential in many of the countries. There have been very few efforts to actually ensure the continuation of the provision of abortion. And on the other hand, in some countries, there's the implementation of telemedicine, which is something that people and like autonomous health movements have asked for a long time. And the pandemic came to show, as MC was saying, how easy it is to actually implement these measures. So in Uruguay, we have a very burdensome process for access abortion. And while it was declared essential, so we were trying to continue providing the abortions. Hey, there is Nana. So while they were trying to continue to provide the abortions, one of the biggest kind of like requirements that becomes very burdensome for people seeking abortions is that you have to have a consultation with 3 professionals: a social worker, a psychologist, and your gynecologist, and they need to be together. And thanks to the pandemic, right, the Ministry of Health implemented that this can be done by a teleconsultation, right? So it shows that it is not it's not only super easy and not costly at all, as it was argued before, right? But it's actually something that it can be easily implemented. It's preferable even in the long term. So I also share with MC the predicament about keeping telemedicine as an option for people that want to do it, even after the pandemic, for example, in the UK, right? And maybe I wrap up here, and I leave space for Nana that has rejoined us.
Yeah. Maybe we can just give some minutes to Marie Claire, because Nana, since we lost you for a while, we jump into a conversation about similarities in different regions. So first, when Lou, I want to give some minutes to Marie Claire to respond, and then we're going to you, and hoping that you don't lose connection again. So thank you, welcome back. And this is how it is, the virtual life. Thanks, Marie Claire, you can go.
No worries, this is, yeah, definitely virtual life, but we continue. So I think that, I mean, for me, definitely the political, and I'm sure we'll hear from Nana as well, some examples of the political opportunism in Swana and Africa related to COVID. But I think this is a big thing that came out of the report, and these kind of worrisome trends in the ways in which lawmakers have pushed for the adoption of laws or policies that, in the guise of this kind of like, it's an urgent response to the pandemic, this has to happen. And as Lou said, is completely unrelated actually in most ways to a response to a public health crisis, and they're neither urgent nor related. And for example, as part of like a wider grab for power during the pandemic, Hungary's government introduced a new law that had a penalty for up to 5 years, 5 years in prison for criminalized the spread of false or distorted information on the pandemic and COVID. And that was also used for, of course, information and resource that had nothing to do with the pandemic. And there's other governments, like for example, in Serbia, the government attempted to implement rules around information related to COVID, that it was only allowed to be shared via the government website and not through, by the crisis, I think it's called the crisis unit or crisis management or something like that, and not through media or certainly severely restricted. I mean, that was rolled back very quickly because of pushback from human rights defenders, but there's so many examples of the ways in which governments have used this as an opportunity to further, as I described earlier, some of the measures and approaches that they've wanted to really push, and this is giving them space to do it. So we have to be very vigilant as civil society, and it's a lot, because there's a lot happening related to that is being linked to COVID that we need to keep very close eyes on, from everything from housing regulation through to health services privatization and selling off, through to policing and anti-protest bills. So
thank you, MC. So we're going back to Nana, and as I was saying, I want to pose to her the same question that we made to Lou about the social control. So the report speaks of the use of law and policies, supposedly COVID-19 related, as tools of social control. Can you explain a bit further this phenomenon, and how have you observed this in the Africa and Swana region and beyond?
Can you hear me well?
Nana? Yes.
No.
Please go ahead.
I think I'm breaking up. I will stop my video. Just
okay, you are good now, but you can stop your video. That increase.
Can you hear me now?
Yes, go ahead. Nana, are you speaking? We are not hearing you if you are speaking. I cannot hear Nana. I don't know if I'm the only one or... Okay, she's coming back.
I think there are too many cameras on and my internet is not really stable. So
we can switch off all our cameras when you're speaking.
Okay.
So you can have like a better connection.
Yeah, sorry about this.
No, thank you. Thank you.
Yeah. Can you hear me well now?
Yes.
Yeah?
Yeah.
Not seeing, I don't know if I'm...
You're good, Nana.
Hi, Michi, can you hear me?
Yes, yes, I can hear you. Can you hear me?
Oh. I'm here. Yeah, okay. You can hear me now. Fine.
Yes, yes, go ahead.
I'll jump straight into the point of social control. So what we've really seen through the desk review that we've conducted in the Southwest Asia and North Africa region, along with other sub-regions in Africa, because we did split them into two regions, basically is the new phenomenon of the citizen informant. So you have not only the police forces that you now have to worry about, or the
Nana, we lost you. I'm sorry. Oh, when we actually totally lost her. So in the meantime, hoping that she can get back and finally have her insights, I would like to remind you that we can have your ideas in the chat box, but also if you want to speak, you can raise your hand and we can give you the floor to make comments. And I think we have a comment from Baljit Banga. She said in the UK, it is clear that we need to address structural inequalities, which are deeply rooted in the UK society and that manifest structurally, institutionally, and through a policy. During the pandemic, these have been highlighted very clear in the UK society. This must be named because if these are not, then the issues remain invisible and responses remain perfunctory. So thank you, Paljit. I don't know if there's, yeah, thank you. I don't know if there's someone who, oh, Nana, you are here again.
I'm sorry.
Great. So go ahead, Nana, go.
So basically, I was talking about the citizen informant phenomenon that was basically having people fearing to get the virus so much they want to be this good people working for the better good for everyone.
Okay, I think we lost Nana again. I just want to point out a question that we have from Cassandra and our interpreter, and that's a very interesting point. She's asking if there are citizens informants in other regions. I don't know if Lou or Marie Claire wants to say something about this. And also if we have other people from Africa or the MENA region or Swana region who wants to say something about what happened there, you are more than welcome to raise your hand and we could give you the mic. I don't know, Lou, Marie Claire, if you want to address the issue of citizen informants, if we have found something about this in the report. Hi, Nana, again.
I'm sorry. All right, so I'll jump from the
go ahead.
Informant case. I don't think it's bringing me any good luck. So I was just saying that how also the media participated in this phenomenon by actually airing those recordings of people not wearing face masks and ridiculing this as being irresponsible and so on and so forth. This was one of the ways that the state has extended its
Okay, we lost Nana again. So please, and we have one comment from Marisol. She's from Mexico. In the chat box, she said the Nuevo León law that Lou was referring to at the beginning was very much relying on citizens' informant. So I don't know, Lou, if you want to say something about this, and also Marie Claire and.
I just wanted to point out that, for example, in Mexico, there were a series, and in other countries in Latin America, there were a series of people informing the police that they were breaching quarantine measures, for example, and they were coming from their shift at the hospital, or they were essential workers somewhere else, right? So I think there's a to a certain extent, there's all these measures, the criminalization, the constant control and surveillance, and so on and so forth, creates this mistrust, and there's stigma on people that are breaking quarantine or not, because they are coming from work or whatever it is that they're doing. So people started making giving this information to the police to pursue prosecutions, which contrast starkly with the level of, like, for example, citizens' engagement with issues of domestic violence, for example, in which people were not reporting incidents of domestic violence that they could have witnessed or whatever, but they were rather reporting people that were breaking quarantine. So all of these issues, to a certain extent, create this like sense of fear and distrust, in which everybody is the enemy to a certain point. So I think it's also important that we have and that we like really put an emphasis on the overarching, like in the very extensive impact of criminalization of a pandemic that go way beyond people that are like effectively prosecuted, like the creation of an environment of fear and mistrust and so on. So yeah, I just wanted to share that. And I think the point that our colleague Baljit, I hope I'm not butchering your name, was sharing about the structural inequalities, like if we think about it, the imposition of mandatory quarantine measures was not accompanied by, for example, measures to curb, as MC was saying, rough sleepers or people that are homeless, right? Evictions continued in many of our countries, continue to take place, while at the same time, these people are being criminalized for breaching quarantine measures. So you can see how pervasive and how violent this sort of approach is when you take something that is a structural inequality in which like no measures were being taken, and then you impose criminal sanctions over it. And I think South Africa is a really good example on this, because they actually went into, to a certain extent, a criminalization of homelessness, giving police powers to search the vehicles or homes of people if they were informed that there could be a potential breach of quarantine measures. What does this mean for a big percentage of the population that don't have the means to, don't have the luxury, and those don't even, like, let's not even go to the people that whose livelihoods depend on the informal economy, that have no choice but to go out and seek their livelihoods, and they had to basically breach criminal law in order to do this. So I think it's really, really important, and what we wanted to do with this report is like let's start this conversation. We need to, and if we see that it's so widespread across regions, I think it's really, really, I mean, super relevant.
Thank you. I don't know if Marie-Claire, you want to respond, but also if Baljit wants to say something, I want to open the mic.
Hi, thank you.
Thank you. And then Marie-Claire.
Okay. Yes, I was just writing to say thank you to Lucia for responding to that question. I think this is a very serious question about structural inequalities and the political economy, because we are seeing these draconian laws come in all over the world. And here in London, you know, we are seeing increased police powers and all kinds of suspensions on the rights that we felt that we had secured through laws, but we're seeing this kind of microaggression that's occurring, and it is very alarming. So I think the other part about this is the fact that, you know, we've had a budget in this country recently, and austerity is called for in the budget. And with austerity, it means that, you know, civil society will actually shrink. So rights-based NGOs, all kinds of other spaces that we have secured for ourselves as women will start to disappear. That's been happening already. So COVID didn't do this to us. This is the true nature of structural inequality. And this has been there historically. It hasn't been addressed, and what COVID did was shed a light on it to say, we need to address these issues, and we need security and protection in our laws to address these issues. So yes, thank you for highlighting this issue as well, because it is very, very serious. And it also means that, and as I said in my first comment, if we don't talk about it, then it does go back to business as usual, and we must avoid that.
Thank you, Baljit. Now I don't know if we can open the mic to Pame, because Pamela also wants to say something while we are seeing if we have back or not to Nana, which is the big issue of the night today. Pame, are you there? Pame.
Hola.
Sí, ahí estás.
Ahí estoy.
Sí.
Perfecto. Gracias. Soy Pamela Martín García, de Argentina. Había iniciado con un comentario que había leído la moderadora Michi acerca de una situación muy particular que pasa en una provincia del norte de Argentina, donde nosotros, después de haber tenido una cuarentena en todo el país muy extensa, un aislamiento muy largo, en esta provincia se establecieron centros de aislamiento, en donde las personas se hacían el test de COVID y al otro día, en vez de acercarle el resultado, la policía los pasaba a buscar por sus casas a cualquier hora, los arrancaba de la cama y los ponía en los centros de aislamiento, les sacaba el celular, los separaba de su familia, como si fuera un centro de detención más que un centro de aislamiento para cuidados con respecto a la situación de la pandemia. Y eso también se dio con mujeres de pueblos originarios que estaban embarazadas y que temían por contagios y por su propia modalidad nómade se van al monte, pero a su vez se iban al monte a esconderse porque temían, por varias situaciones que pasaron en hospitales de las ciudades de Formosa, de que separaban al bebé recién nacido de la madre o incluso no dejaban ingresar al padre a ver al recién nacido. Esta situación está siendo muy grave incluso en este momento, con muchas manifestaciones en las calles de la población que ha salido a reclamar fuertemente al gobierno de la provincia, y ha sido el accionar muy duro de la policía, y también ha echado luz sobre esta distancia, ¿no?, que hay entre los pueblos originarios y el acceso a la salud y el acceso a sus derechos humanos. O sea, la pandemia aún profundizó esta crisis en el acceso a los derechos y, por supuesto, el aumento de la criminalización y el uso y abuso de la fuerza por parte de los gobiernos. Gracias y felicitaciones por el panel.
Gracias, Pame. Now I want to give some time to Marie-Claire, who wants to have some points. And after that, we have Nana back for now. So after Marie-Claire, we're going to try again with Nana. Marie-Claire?
It's fine. I was just going to add to, we can move to Nana, but on the citizen reporting, like it's really, the trends around some of these are so important to highlight because, for example, in the UK, there was, active encouragement from ministers, from the government, from police forces to report on, for members of the public to report on one another if they feel that their neighbour, their friend, their acquaintance was breaching any of the COVID rules. And they even had, for example, forms on their websites that you could go on and fill in, like each individual police force had that. And the thing is, this is like, a trend in terms of, for example, a few years ago, there was an active encouragement of reporting undocumented migrants. There was posters that were being driven about major cities, encouraging citizens for the public to report cases that they know of. So yeah, just to highlight that as well in terms of the trends that that we've been seeing around citizen reporting as well. But on to Nana.
Thank you, MC. Okay, Nana, let's see if we can have you finally on the floor. So we can switch off our cameras and let you to.
I think it's working fine now. I changed my location. I wanted to add, in terms of social, I will move ahead. I'll move from this point. I don't think it's a good luck. It's bringing anyone good luck. So from the citizen informant phenomenon to the other trend that we've seen very prevalent and very present in the two regions, Africa and Southwest Asia and North Africa, was basically the false news, right? So this has been a very easy to grab charge for authorities to charge anyone who's breaching the precautionary or preventive measures. So for instance, in Egypt, when the prison suspended communication between prisoners and the outside world in the name of precautionary measures, we've had a case, a very popular case of a family who was trying to get in touch with one of their members who is now in prison, and they couldn't hear from him for too long. And now what they did, they protested that. And because they protested that online also, not just in front of the prison gates, one of the family members, actually his sister, got charged, and today she was sentenced to 18 months in prison because she instilled terrorism through through social media in Egyptians by spreading false news on coronavirus. This is a very accurate example of how coronavirus is becoming the new war on terror. It's becoming the new war on drugs. It's becoming the easy way for any authority to expand its political public control. In addition to that, what happened in Lebanon, for instance, right before the pandemic was announced as such, public demonstrations and gatherings were actually disrupted by security forces in the name of controlling the virus spread. Again, this would also be thought of as political opportunism, of like how you can shut them up and shut them off oppositions to gain more ground. And this also happened again in Malawi when the former president tried to actually postpone the presidential elections because for him that was not the right time, and like he used a lot of public health. He justified his proposal as in favor of public health and controlling the virus spread, which wasn't, and the Supreme Court actually stood against that proposal. And anyways, like the presidential elections went on, and it was business as usual. And again, it's how one last case on that is what happened in Uganda when the president actually asked directed the security forces to arrest any opposition member who would distribute goods, because that would mean that they would gain more power and more popularity. And that was being charged as an attempt murder, sorry. So like the extent to which governments have been pushing this as something full of terror, especially in the beginning of the pandemic. Now, I guess we're all, especially that the report is focusing on the first quarter of the pandemic. And now we're all, I think, there is a collective wit of like how this is not really the way it has been packaged for all of us. I think it's in the beginning, it was really easy for men in power to just like carry on, because like we're talking about something that we don't understand, the virus that is very ambiguous and dangerous. Yeah, I think that's it for the social public control, and also for the political opportunism. Do you want me to? Yeah.
Yeah, I want to ask finally, what were other non-punitive responses states adopted in response to the pandemic in Africa and Swana region? How effective were these such measures?
Well, one of the things that we were looking closely at while we were actually piling up pieces of data was basically how the governments were really keen on issuing punitive measures and legislations, and not really stimulating the economic impact that was imposed by the virus on people. So while some governments on paper issued economic stimulants that looked good, but when we did our interviews with, for example, in Nigeria, there was what is called the Empower scheme, and that was led by the the Ministry of Humanitarian Affairs. It was basically to actually stimulate unemployment before the pandemic, and it was again picked up during the pandemic before May. But what we learned from that interview was basically that a lot of people could not actually get access to the payments because of the lockdown. So there wasn't a way that the ministry, when they did think of this as an economic stimulant, they didn't really think of a way that they can actually make it accessible at the same time. And in Egypt, it's similar, because like we had a study coming out actually looking at the impact, the economic impact on households through May of last year. And it was supposed to have so it was supposed to see how many households and families could actually get access to what is about $30 American dollars per month for unemployed individuals. The study actually figured that it only reached 5.4% of households that it was supposed to reach. And now it's just really feeding into our observation of like how it made sense for people to fear hunger more than the virus, to figure out ways also to breach the rules, because like they did fear starvation. And especially we're speaking of countries where informal economy and gig workers are the majority. So like just not having any social protection benefits in place before the pandemic made it even worse during COVID. I think one last point on that. I think one of the things that I wanted to add in terms of like the socioeconomic aspect of it that MC had mentioned earlier, of how much we've realized that all of the things that civil society have been asking for and feminists have been asking for over the past over years are now just like ready and in place and easy to apply from governments in terms of social protection. In the DRC, Democratic Republic of Congo, there was actually a 2 months free of charge on electricity and water for everyone. So like you would think of it, oh, so like, I mean, like we haven't really traced it because that was beyond the time frame that we were looking at. But it was like really interesting to see how all of the public goods and all of that infrastructure was there and easy to have access to, but I mean, there wasn't really a political will to be more understanding of poverty impact on families and individuals. And I think I can stop. Yeah, I have my cat, sorry. I can stop here, but, and we can go back to the conversation and I'll just hop in.
Thanks, Nana. And cats and dogs are welcome because this is how pandemic life goes. So don't worry, Nana. Thank you. And I want to ask all the people that are here that if they have some examples or interesting things that they want to share about all these trends that we have identified. I don't see raised hands, but okay, I don't know if there is someone. Lou, do you want to say something? And also you can just comment on the chat box and we'll open your mics. Thanks, Marisol. I don't know. I have my own questions. Since I'm the moderator, I have my own questions to all you. One thing that it's interesting that we found in the LAC region is how during the pandemic there were some crises, political crises in some countries that were in a way, as Lou said, they were manipulated by governments to persecute their political enemies. And for example, Bolivia is one example. Also, we saw some similar, but with lots of difference in Chile. And there's other countries like Paraguay, countries in the region that because of the lack of response of governments during the COVID pandemic you have people demonstrating in the streets, and to respond to that, some governments has put in front of everything like the criminalization of the sanitary measures of the health measures. So, for example, here in Paraguay, there is an article in the penal code that they are using and applying for people that are breaking the sanitary rules and being outside their homes or not wearing masks and everything, which actually is very unclear legally if that's good to do. But the thing is that governments are using these criminal tools to respond actually to political criticism. So my question for Nana and for Marie-Claire and also for Louis, if she wants to add something, is can we say that this is something that we found in different regions, and we can say that there is, I know that you all touched a little bit about this, but I want to see if we can agree on the fact that governments are politically manipulating COVID-related laws, especially the criminal part of that, to applicate in a way the criticism because of the lack of response on the pandemic. So I don't know if someone wants to And then we have some question from Cynthia in the chat box. So
Sure.
I don't know. So,
I
Nana?
think, yeah, I can respond very briefly to this because we've seen it, for example, in Syria. So when you had health providers actually talking about the lack of protective gear and how the war has torn the health infrastructure over the past 10 years, the response that came from the government was not actually to talk about or to fill in this gap of like the lack of protective gear. What they did was actually banning the use of mobile phones and also charging doctors and health providers with spreading false news. So again, it was very clear how governments really shifted everything to be terrorism. And it was interesting when Lou actually made the point earlier of biological terrorism. It's like crazy how many qualifiers anyone put before terrorism for everyone to panic, right? So yeah, so I think that's one of the ways. And the other thing that happened also in Syria was how mobile applications that were initially made and launched for health surveillance, so that they would be able to track the contact of whomever is being suspected of carrying the symptoms and the virus. But actually there was a report coming out saying that application in of itself had a spyware. So you can see the moment that they're putting or employing a feature to make everyone's life easier, they've already been proactive and taking steps ahead of us by using it for other political reasons of actually oppressing and stopping political analysis or even just observations from people on the front lines. So yes, I just wanted to share this bit.
Thank you, Nana. I don't know if Lou or Marie-Claire wants to add something, and then we have a very important question from Cynthia. Yes, no? I will move on. So we have this question, and I think this could be our final question because we have like little more than 10 minutes to end this session. And this is Cynthia's question. What's your expectation for situation actually improving? And that was like improving. It's very hard to imagine getting to a better context with states giving up some of the ways they exert control. What do you think is possible in the next few years? Thank you, Cynthia, for your question. It's a very important and profound question. I don't know if we want to have like a couple of minutes each to say something about this. And thanks to Cynthia for her question.
Yeah, thanks, Cynthia. It's important to end with a bit of optimism, I think, for sure. I mean, certainly for this region, I think, and the UK context, there is a lot of mobilization happening around the ways in which the pandemic is being responded to by the government. There's a lot of, in particular, feminist-led mobilization against the police and against, not just to do with COVID, but the bubbling up of everything that we've had over the past few decades in terms of their response to gender-based violence, issues of structural racism, etc. So, there is hope in terms of that and the mobilization that's happening against some of these measures. I think that there is, it's not all bleak in terms of the I think the one thing that we can't let this be the new norm in terms of the way crises are responded to, the ways in which the public are reporting on each other, or just the general kind of response that we've seen from all aspects of society in all our regions. So yeah, and doing things differently, as our colleague said, as Baljit said, in terms of not moving away from the status quo and really holding the decision makers to account.
Thanks, MC. Lou, do you want to say something?
Yeah, I mean, I think you touched like a very, very important point, Cynthia, and I don't have any conclusive answer to your question, rather more an invitation to all of us to think more about it. But what I would like us to reflect and think, and I think this is part of a bigger conversation that Vecinas and RESURJ is trying to do, is that while I cannot vouch for our government's good faith or like nowhere near that, I can own what we are trying to do, and is trying to, like, from a feminist perspective, question those policy and carceral policies, right? Like, why do we, within feminist circles, we still propose criminalization as a measure, or like as sometimes as the only measure to tackle social problem, right? So like, to a certain extent, erasing the complexity of that. There's many conversations, for example, gender-based violence, for example, like right now that there was a shooting of Asian women in the US, a lot of people calling for further policing and further criminalization. The carceral state, the whole like police apparatus and its violence is not the way to go, and that is not the feminism that I'm trying to foster and trying to propose. So I would also think that while we cannot control what the governments are doing, much more than advocating and continue to insist that this is not the way to deal with public health crises, and this is not the way to deal with complex social problems that reveal like deeply embedded in like inequalities, right? We can insist that with our governments, but we ourselves, as a project, as a plan for a future, and we think what is our way ahead, also to start questioning and start challenging our own resort to criminalization as the way, or partially the way to go. So I would, that's what I would like to end on. But thank you so much. I mean, I think we're at least me. We're all gonna stay reflecting on this.
Yeah, thanks, Lou. Nana?
Yeah, I mean, maybe one thing that I can think of is basically like all of the things that that we think of as positive that came out of this pandemic, like the release of prisoners of minor crimes, or pregnant prisoners, or I mean, these are successes that we can really hold on and like maybe take them with us post-COVID. I don't think there is such a thing as post-COVID, but I mean, it is something that there are a couple of things that we can think of as gains that we can take with us, like the telemedicine and abortion services over the phone, and so on and so forth. I think adding to what Lou said in terms of what we can do in our analysis and our political moves and our what we think of as a strategic ask, we can also think of what are the gains that we have on us now that we can hold on to very firmly and not let go of when everyone is vaccinated, you know. So I think maybe, yeah, reflect on that a little.
Thanks, Dana. Thank you for all your thoughts, for reflections, and also I think like kind of the question of Cynthia is kind of, okay, let's wrap up this because we have a lot to still go on to. But I have like 3 little points to share with you before we say goodbye for now. First, we have one question from Marisa in the chat box, and it is also interesting to see how the language of war on the virus and the use of the military being normalized and criminalization being applied to citizens, but not to politicians. That's really interesting, and it is actually another topic to go. The second is, we have in the chat box also a comment from Rebecca, and she said, hello from the Mega Research Foundation in the UK. Thank you all. We have been mapping cases of abusive use of force in the context of policing in the pandemic. Please get in touch if you, and we've missed, and she left her email address and also the map the link to go to the map, and I think this is interesting. And last but not least, of course, we have, I don't know if Marisol you can reshare the link of the report, and that you can find in English and Spanish in RESURJ webpage. You can go through there. I think we would like to have another space, for example, in different regions to discuss like more specifically what we found. And for now, we just want to share that we think that the feminist analysis is really important in this context, and especially because the pandemic is not over, and we don't see when it's going to be like the post-pandemic era. And in that way, we really need to be aware of everything what's happening and have like a feminist point of view of everything. So thank you all. Thanks to the amazing panelists. Thank all the team, the comms team of Vecinas and RESURJ for making all this looks good and function actually. And thank you all for your time, because we know that you are running through CSW, are virtually running through the CSW's event and meetings. So we really appreciate your time. And you can follow us in social media. And if you want to let us know anything about the report, or have comments, or want to further have a conversation with us, we are actually really willing to have those conversations. So thank you. Bye-bye.
Bye-bye.
Thanks, everyone.
Thanks.
Bye. Thanks, Michi.